Hi, my name is Maddie, and I'm going to be doing my extension assignment on bipolar disorder and how it affects relationships, primarily focusing on long-term adult relationships before marriage. So just some general facts, bipolar disorder is found equally across genders, so either partner is equally likely to have it. It tends to manifest around 18 to 20 years of age, so the age most people would consider to be an adult relationship. Symptoms of mania versus depression. In a relationship, mania can look like hypersexuality, which means your partner may be cheating or just always in the mood. There could be excessive spending. So if you are saving up for something, have joint bank accounts, or have debts or loan to pay, it could be hard. It is also hard for your partner to keep up if the partner with bipolar disorder has little need to sleep. On the other hand, depression can appear as low sex drive, which is a big change from always being in the mood. There could be an apparent lack of interest in your partner, especially in contrast to the amount of affection your partner may show you while manic. And there could be less physical and emotional affection, which could leave you feeling rejected. For both, it is hard to hold a job. Like I said, if your partner is depressed, they could not want to go to work, or if they're manic, they could quit their job. So going back to the aforementioned financial issue, they could not appropriately financially contribute. There could also be hurtful words or behavior towards the partner that they do not really mean. Therefore, there could be compromised communication, and the partner without the disorder should not take it personally. For my study, I chose one from the American Psychological Association, which was published in 2018, called Social Support and Relationship Satisfaction in Bipolar Disorder. So the study prefaces that people diagnosed with bipolar disorder are less likely to marry or live with a partner, and those who do are at higher risk for relationship issues compared to individuals with any other psychiatric disorder or without a mental illness. Therefore, people with bipolar disorder have a high need for social support, and they often do not receive enough of it. Since there have not been many studies done on this topic in the past, they wanted to test the relationship between social support and relationship quality among couples in which one partner has bipolar disorder. So for the study, they used 38 opposite sex couples in the United States for the study, where one person had to have the diagnosis of either bipolar 1 or bipolar 2. The couple also had to have been married and or living together for at least 1 year, and partners had to be between the ages of 25 and 64. They wanted to use these couples to measure social support and relationship satisfaction, as well as the psychiatric symptoms associated with mania or depression. They did so by having each couple write 26 weekly diary entries and rating both the social support and relationship satisfaction they felt throughout the past week. During the study, they looked at each patient's report of emotional support they received from their partner, for example, expressions of care and understanding. Partners without bipolar disorder were reporting less emotional support than the partner with the disorder. As I mentioned earlier, while it is crucial to support your significant other with bipolar disorder, it is more difficult than to give that support back. By the end of the 26 weeks, results showed that greater social support was associated with higher relationship satisfaction for individuals with bipolar disorder and their partners. Also, more support than usual in any given week was associated with higher relationship satisfaction that week, meaning there was a direct relation between the support and satisfaction. So the study concluded that there is an association between social support and relationship quality and individual well-being, both for the partner with and without bipolar disorder, and particularly when the intimate partner is the support provider. So the importance of understanding is that these symptoms can be highly confusing and stressful for a partner who does not have previous experience with the disorder. Effective ways to handle this start by understanding the disorder and what the partner is going through. Learn to spot oncoming mood changes and how to support your partner, so you need to do your research. Something else you can do with your partner is going to couples in therapy, because it helps open a line of communication with the help of a professional. It also helps with understanding each other and accepting current strains in the relationship. It does take patience. The big picture is that it takes great commitment, communication, and patience. So people who suffer from mental illness don't want to be defined by their disorder. So it's important for you to remember why you fell for them in the first place and all the good memories you've had so far. Thank you so much for listening.